Today we're at Hope Cathedral in Jackson, New Jersey, providing and setting forth a very wide-ranging array of health screening and educational services. So much of a person's health relates to where they live, what they eat, are they having access to care, are they getting screened?
It's really important to bring preventative care out into the community, to know your numbers, to get screened, making sure that people stay healthy and only going to our hospitals when they need an acute care setting.
Our partnership with RWJBarnabas Health is very important to, not only to me, but to our chapter and the community, because we actually have practical resources that are brought right into the heart of the community. And in fact, there's a presentation going on right now about diabetes awareness and health.
We now have much more preventative and earlier diagnostic approaches, whether it's genetic testing, lung cancer screening, cardiac screening. And I think the big takeaway for people is to realize that there are tests within the RWJ system where these things can be identified earlier and change the trajectory of your life.
Our mission at RWJBarnabas Health is to build and sustain a healthier New Jersey. You quite simply can't do that without being in the community, meeting them where they are, and engaging in events like this, where we're offering screening services, education on nutrition and chronic disease. This is really essential to how we meet our mission.
RWJ has been a blessing to partner with the Links. It is the greatest partnership that any Link chapter can have is with a hospital with as generous as RWJBarnabas. They bring to the table so much knowledge and so much care.
For attendees, I hope that they are able to gain practical resources. I hope that they are able to gain health information, but more importantly, know to follow up with their primary care physicians.
Working with community partners, the Links, Black K.A.R.E, Hope Cathedral, and by engaging in screening and testing and education, we will literally save lives. If we pick up a cancer, if we pick up somebody with hypertension, if we pick up somebody with diabetes and we're able to enroll them into a chronic disease management program, not to mention identify and treat a life-threatening disease, we'll save lives today. And that's what makes this all worthwhile.